is Kate, and I'm here today to talk to you on why you should add naloxone to your first aid kit. So, this is my Girl Scout Gold Award project. A Gold Award is the highest award a Girl Scout can earn that is done by identifying a problem and creating a solution that has both a sustainable and measurable impact. The problem I identified was that opioid overdose deaths have been increasing. Opioid use, accidental overdose, and death are problems across the US. These can happen to anyone. Your community is not immune. Let's quickly define what an opioid is. So, they're based on the opium poppy. Common medications include methadone, oxycodone, hydrocodone, morphine, codeine, tramadol, and fentanyl. You may have heard of fentanyl. It's been in the news a lot recently. The DEA estimates that 6 out of 10 of their seized fake prescription pills contain fentanyl. This is concerning because fentanyl is extremely potent. It's 50 times more potent than heroin and 100 times more potent than morphine. This means that the first exposure often causes death. In 40% of overdose cases, a bystander was present. Would you be prepared if that bystander was you? Today's goal is to prepare your first aid kit with naloxone, to teach you to recognize the signs of an opioid overdose, and to have you respond with naloxone. So, what does a potential opioid overdose scenario look like? Well, let's say you just had knee surgery and your family comes and visits you, but their child or grandchild sees your medication and takes it thinking it's candy. What do? Well, besides calling 911, you would administer naloxone. Naloxone, or its brand name Narcan, is an opioid overdose reversal agent. It works because when you take an opioid, it fits into specific receptors in the brain, brainstem, and peripheral nerves, creating a euphoric and pain relieving sensation. When you take too much, you get slowed breathing, unconsciousness, and other symptoms we'll talk about on the next slide, but those two are the most important because those are the ones that can be fatal. Naloxone binds more aggressively to those same receptors. It kicks the opioid off that receptor. It only works for about 30 to 90 minutes though, so that person should still go to the hospital. So the signs of opioid overdose include unresponsiveness and unconsciousness, constricted pinpoint pupils, snoring and gurgling sounds coming from the mouth, blue lips and nails, slow, shallow, or stopped breathing, and cold and clammy skin. So, you suspect an overdose. What do? First thing you do, you call 911. You tell them what's happening. Next thing you do is you try to wake that person up. Then you would try naloxone. To administer naloxone, you hold it with your thumb on the plunger, and you would tilt that person's head back and place the tip of the nasal spray in either nostril. It doesn't really matter which one. Then you would press up to administer the full dose. There is no testing dose in a unit of naloxone, it's one and you're done. Then you would wait 2 to 3 minutes for that person to respond. If they don't respond, then you would give additional doses until help arrives. You may notice that that person has stopped breathing, in which case you would need to perform CPR. Most places have some first aid and CPR trainings pretty regularly, but the 911 operator can walk you through CPR and rescue breaths if it comes to that. So this is a map by the Harm Reduction Organization. It's a nationwide map that tracks places where one can obtain naloxone across the US. I noticed that when I zoomed in on my general area that there weren't very many. So I went to my local Walgreens and Rite Aid, which are the two closest pharmacies, to see if it was available there. It was available at the Walgreens. It was not available at the Rite Aid when I went, but it's usually $30 to $40, and the California Naloxone Distribution Program is a great resource for community organizations looking to obtain a bulk order. So we taught you how to recognize the signs of an opioid overdose and how to respond with naloxone. Now let's equip your first aid kit. This is the point in my presentation where, if I was speaking to you face to face, I would physically give you naloxone and then just ask that you fill out this brief survey so that I can track its distribution across my community. Unfortunately, I cannot do that in the form of of a video, I can use this time to ask you to please figure out a place, figure out where you can obtain naloxone, and go out and get it. That is like the most important thing because we can talk about its importance all we want, but if it's not in the first aid kit, it doesn't really do anything. As you can see, I use many sources to educate myself and hopefully you on this topic. I would be happy to share these slides with you if you would like to assist your community on educating itself on the importance of having naloxone in your first aid kits. Thank you for listening to me. I hope you have a great rest of your day.